Thank you. Hi, everyone. Okay, so I just want to start with telling you a little bit of a story. So I'm sat in a room with lots of charts and lots of data, with lots of numbers flying around everywhere. I'm just sat there thinking, I have no idea what is happening. I'm a mental health nurse, and all that's running through my mind is, what about this person in the community? I've got this to do, I've got that to do, I've got that to do. What relevance is this meeting to me? Because every language. I can't wait to get out of that meeting. What are the things I need to be getting on with? Frustrated and flustered, feels stifling, the clock's just crawling past. So that's the theme of my presentation today. That's speaking the same language. My name's Nadine Rooney, and I'm going to tell you about my journey from being a data skeptic to being a passionate advocate for data analysis. I'll pop your code on there. I will come back to it because that's what I'm going to try and sell you today. So just bear with me, it'll all come clear. But I just want to take you back and tell you a little bit about why I might be slightly different to every other mental health nurse and every other person who works in the NHS. I haven't always worked in the NHS. I used to work in finance. I used to sell stuff. I used to sell mortgages. I used to sell protection. I used to sell insurance. And part of that selling was about talking that same language with that person, mirroring that language, and also looking at what they wanted, what were their needs, desires, dreams, what did they want to achieve, what am I looking at in their financial health, and then match that with a product. But not by telling them, I've got this product that does this and this. I do it by telling them a little bit of a story of how that can personally impact them. So I'll pop this chart up on here, and I know that a lot of you are already looking at that thinking, well, which one am I on this one? So this is something that we get taught a lot in sales and finance, about mirroring each individual person. Now, you're not necessarily going to land into any one particular section. So, we've got the blues that are down here, very task focused. They want lots of data, they want lots of information, they want time to spend and have a look at what that might mean for them. We've got the reds that are up here that are very much, just give me all the information, tell me what I need to do, I want it now, I want it clear, I want it concise, I want to be gone. They're the drivers. I'm very much over in this section. You find that a lot of nurses are over in this section, a lot of healthcare professionals. We're people focused. We like telling stories. We like to connect with people. We're connectors, we're networkers. That's what we like to do. So part of sales is understanding how sometimes I might need to sit over in the red, over in the blue, or even over in the green, and mirror that person's language so that I can sell better. It's easier for them to understand what I'm saying if I sit in their section. So I've popped over here. Which one are you then? And I know that normally I talk to strategic managers, I talk to operational managers, commissioners. So when we're talking to commissioners, all they want to know is what you're trying to sell, mate, how much money is it going to save, and can I invest that somewhere else? Is it a good investment? They tend to sit in the reds. Then we've got strategic managers that tend to sit over in the blues. And operational managers, sometimes between the green and the reds. Frontline professionals, definitely a yellow. So that's where they sit along there. So in healthcare, what I've managed to do is take what I've learned in sales, in matching that, and mirroring that language and taking it across over to there. So that's been quite a bit of a strength for me in terms of being a networker, a communicator, a connector. I connect people. I bring them all to the meeting, and I've found that I've got this great skill of being able to speak the same language as different people need me to. I'm not so good at data. I'm not. Even though I was selling mortgages, the only thing that I would tell you is I didn't even realise at that time that I was actually crunching data. Everybody crunches data. Everybody does some data analysis. Even housewives looking at their household income. I was looking at how many sales do I need to meet this month's target? Do I need 20 bums on seats, appointments, that's what we used to call them, to make one big sale in this area that's quite affluent? Or do I need more, bums on seats, 30, to make 6 smaller sales in this area? What's the branch average? What's in my pipeline? So I was already analysing all of that information. But I didn't recognise that as doing any sort of data analysis. I didn't. That was just me wanting to meet my targets that month. I also never recognised myself as a salesperson. I'm a people person. I'm a yeller. I want to know, what do you need and how can I help you? On the flip side of that as well, that's what drove my sales. So everybody thought I was this fantastic salesperson that used all of this information. I didn't. I just wanted to know, how can I help you? And here's how I can help you. Drove my sales. So it's strange, isn't it, that not always the usual stuff and the usual tactics are the things that work. And it depends what your internal or the other person's motivations are. What are they looking for? And we need to get online with that and align those goals, don't we? So that's where I was. And then I decided to jump ship. There was a credit crunch, people struggling with it, people have got lots of mental health problems. I wanted to be on that side. I retrained, I became a mental health nurse. I then found myself working, so I was mental health nursing, and I wanted a new challenge. Oh, look, shiny, shiny over there. Learning disabilities. We're bringing lots of services together. We're bringing lots of different providers and whatever else together. And what do I know that I'm good at? I'm good at networking, connecting. This was a fantastic challenge for me, something new. It was something that I wanted to get on board with. So in learning disabilities, I'm sure everybody remembers Winterbourne View and Scandal, and the mistreatment of the learning disability population. So the government response to that was the Transforming Care Agenda. Their 3 aims were to avoid inappropriate admissions, to reduce the length of time that people were admitted to mental health hospitals, and to protect their rights, liberties, and make sure that people are living a full, life with lots of quality in the community. It wasn't working. We brought that in 2012. It wasn't working. We weren't hitting its targets. Why? Nobody quite knew. Nobody was pushing any numbers. They brought in the Care, Education and Treatment Review. Now, Care, Education and Treatment Review is basically where, there's a panel of experts, an expert by experience, and, a clinical expert that sit on a panel and put challenges to somebody's care. Why have you done this? Why haven't you done it that way? What do we need to be looking at? To make sure that we meet those criteria. Let's get somebody out of hospital quicker. Let's not put them in hospital in the first place. That type of thing. So that's where my job role sort of sits. So mine is to look at the whole system in the West Yorkshire integrated care system. The population, how many admissions have we got? Are there any blockages to that patient journey? So that's where we started from. I was basically a superhero of plugging gaps. That's what I was. No, seriously. So I had to start with mapping and data collection. Brilliant. I thought, not really good at this. Don't recognise it. So straight away they said, right, where do I get this data from? Well, I don't know, Nadine. Have you got the clearance to have access to that data? Well, I don't know. You've told me I need to do this job, so I can't give you clearance for that data. Where does that data sit? Who's got the data? On top of which, we found that we've got lots of different areas that are actually reporting to different integrated care systems. We've got little old Barnsley that actually needs to feed their data into us to access our services. But actually they sit over in South Yorkshire, I see things. So they report their data that way, so then I've got even more challenges to try and get data from them. Oh gosh, didn't even realise how much of a challenge this was for you guys. Then we've got 3 separate NHS trusts, which again, systems don't speak to one another. No, you can't have our data. What do you want the data for? When you've set me a task, I need that data. How am I supposed to do it? Nobody was talking to one another. So we've got 3 NHS trusts. Also got 6 local authorities. And we've got 6 integrated place-based commissioning teams. We've got data. It was going all over the place. It was all apple and pears. I think everybody talks about it as dirty data. Is that right? So it all wanted cleaning up. It wanted aligning. I was set that lovely task at that time of doing that. So yeah, 6 local authorities, 6 ICBs, 3 mental health trusts, and a partridge in a pear tree. That's where I was starting from. So when I did start to manage to get that information, and that data started coming through, I was so pleased with myself. Look at me, bit of data analysis now, you know. And I did all these little charts. I was going into the meetings. I was telling them all about these findings. This is amazing. Look at what I've uncovered. It helped us. I talked about 80% of people in the community being at risk of admission through placement breakdown. I talked about 33% of people not being able to access the right care. And then also look at this. Look at population sizes. So the new admissions. I mean, Craven's percentage population is actually 25% less than Leeds. But yet they've got 4% more admissions. What's going on there? Same with Barnsley and Kirklees, same amount of admissions. But yet Kirklees' population size is double that of Barnsley. Nobody could see what I was saying. So I had to go back down. I had to start looking at the granular data. I had to go back to the storytelling. This isn't landing. I've sat in those meetings. I've thought those things that they were thinking themselves. So I had to start telling stories. I even made little pretty dashboards because I thought that might sell it, you know, there's a bit of a visual there. That was part of the journey for me as well. But some people like playing about with the toggle switches, you know, oh, I like this, I can interact with it a little bit. It tells me all these numbers. They weren't really getting the message though. So I had to take them on a journey. I had to tell them about, you know, Joe Bloggs and his journey and how this simple form that we bring in revolutionised the journey for so many people. Because I'd been on that journey with all those patients, I'd immersed myself in the data, I could see that I couldn't get that message across without telling that information. So thankfully, we have gone from people not caring about the table-based exercise that I'm talking about, to actually being interested. Well, hang on a minute, I know Joe Bloggs, and I've got 2 people that got in the story. It started rolling. The news started spreading. Oh, we're all talking about these people that are affected, and if we change this form, if we do this, if we do that. The situation started changing from everything being an external problem that we have no control over, such as community provision, to all of a sudden we've got simple, quick wins, such as changing the form, as an example. So that's pure, like, my message today is just that. Yes, very basic, I appreciate for what some of you guys might be doing, but for me as a mental health nurse, that's been a huge journey where we've looked at how those little individual stories have made such a huge difference by speaking the same language and showing the value to those professionals, those commissioners, saving people money. We've got all sorts of projects that have spun up from that. We've got a new referral process. We've had funding for, you know, delayed discharges processes and how we look at that, looking at, lo and behold, new forms and, you know, lots of quality improvement. But the main thing that everybody is doing now is, we don't call it data analysis, by the way. We just call it a little audit. I've done a little audit, something like that, that everybody's all right with that. If you say data analysis, everybody feels way out of depth. But as soon as you say, do a little audit, everybody starts talking about it, shouting about it, they're going into different meetings and talking about it. So in a nutshell, yes, it's been quite a journey. Yes, it's been a long one. But I'll go back to the old caller. Just, you know, I want that to resonate with you. It's about talking about something that resonates with somebody. that sparks that emotional feeling that somebody goes away and they remember. Everybody talks about roller polo, everybody knows Peter Kay. Tell that sort of story, sticks with them, sticking factor. That's my message today. Thank you very much.